Thank you, Reda. So just to introduce myself, I'm Dr. Anindya Bose, as Reda said. I'm the team lead of the WHO IVB department. Within that, there's a team of VPD surveillance and risk assessment, SRA in short, where Anna and I work together. And I'm very happy and really welcome you and congratulate you who are part of this course. And this is a fantastic journey, I think, that we will take together. It's not really the usual conventional way of learning. And I think it's a learning journey that we will take together. Our team's mission, just in one or two sentences, is that we would really like to have a system of comprehensive vaccine-preventable disease surveillance across the world in countries that need it most, and we provide the technical assistance for that. This has become all the more imperative because of the many gaps that we have seen in the recent pandemic in surveillance capacities, in surveillance capabilities, as well as intelligence, surveillance intelligence handling, etc. I'd just like to end by sort of drawing your attention to the fact that, as far as I can understand, this course is not really a conventional learning. It's a process to encourage, I think, critical thinking. So it is not all information recall or information reproduction. This will depend very much on your active participation in your churning in your mind the information that you receive and collect, and from there to interpret it and then solve the problem at your own level. And for me, I think the first step in any learning is an acknowledgement in the mind that I'm ignorant, that I do not know, my knowledge is limited. And if I do that, then I'm open to learning from my peers. And if my peer does the same thing, then they are open to learning from me. So that, I think, is a critical component of the mental attitude and thinking in this course, which depends so much on peer-to-peer learning. So I welcome you all, and I wish that we will take a very successful journey together over the next few days. Thank you. Over to you, Reda.
Thank you very much indeed. Let's go now to Anna Minta.
Good morning, good afternoon, everyone. I also want to welcome you, and I'm very excited to have you join the course. You will hear from me shortly, so I will keep my welcome remarks short. But again, I really look forward to working with you all. Thank you.
Okay, that was very short. Thank you, Anna. Let's proceed. There is some critical information that we want to share with you before we hear from Anna. So this is to provide some framing for the course, and also for you to get a sense of who else is here, who is with you, taking this course with you, and emphasizing the critical role that each of you has in securing a high quality and sustainable surveillance system for VPDs. Now, very pleased and honored to introduce a distinguished range of subject matter experts who are contributing to the course in both French and English. So in some cases, you may not see some of the Francophone subject matter experts, but they're very much part of the course, of course. Second is a point about the pedagogy. As Dr. Anindya Bose said, we are using a pedagogy that may be a little bit shocking for you if you're used to the conventional modalities of presentations followed maybe by some question and answer session, for example. We're going to move very quickly, and we are going to challenge you. We are going to pressure test how you do, not only to acquire information, but also to apply it in situ as you work to the real world challenges that you face today. To emphasize the group, the uniqueness of the group that is in the room today, we had 496 applications received primarily through WHO's network. And then of those, less than 1 in 4, 120 learners were actually accepted into the course. Now, you may want to know which countries So we have that for you here. And you can see that there are large groups from a couple of countries, but most of you have between one and five learners who are participating, which places, I would say, an additional level of responsibility on your shoulders. If you are the sole representative from your country who is going to be the first in your country to actually have the opportunity to learn, practice, work towards mastery of WHO's very latest guidance on vaccine-preventable disease surveillance. Now, in terms of who we are in the course, you can see there were 120 selected, with a good mix between people working at international, national, multi-country, and regional levels. So that's within the country. Organizational affiliation, you can see the two largest groups are from the Ministry of Health and from the WHO country offices. In terms of gender, there are 31 women and 89 men participating, and when you can see the age distribution on the right. Now, the years of experience, this list is not quite in the right order, but you can see that there's a broad range. And I would ask for those of you who are very senior in VPD surveillance to actually use that experience to mentor, to support, to help your colleagues who do not have the same experience that you have. And again, if you are new to VPD surveillance, do not be wary of coming into this advanced course. WHO did not select you by accident. There's a careful process of selection used by WHO to bring you into this course. So we do expect you to challenge and stretch in order to achieve the goals of this course. Now, of the 5 main objectives, you can see here the split between those of you, a little bit more than a third, who said that sustainable financing is the topic most challenging in your context. Information systems comes next, then workforce, then laboratory, then applied research. So, very quickly, I'm going to try to summarize what you will need in order to succeed in this in the course. So, first of all, you've received this warning in writing, and I don't want to be overly dramatic, but this is an advanced level course, and the key is really acceleration. Typically, scholar courses in the past, which we've done with the World Health Organization, have been done over the course of 6, 8, or 10 weeks. In this course, we are condensing that down into a 2-week process. This is just part and parcel of the world we live in, needing to go faster in order to do better. And it is therefore your responsibility to ensure that you follow along. And because of the peer review process, deadlines are strict, and we will not be able to grant extensions. We recognize that means some of you, despite your best effort, may not be able to finish the course, but that is part and parcel of this being an advanced course. Now, we will be working in small groups as well as focusing as individually on each of you on your course project. And let me be clear, the goal of the course is not these Zoom sessions. The Zoom sessions are there to help you, support you, scaffold your work on the individual course project. The main deliverable in this course is to develop a quality action plan, the best that you can in the limited time that you have. And the time is very limited. The first deadline is coming up on the 14th of July. So there are 2 parts of the course. You have the course resource folder. We've shared with you the session, the course program. You should have by now reviewed all these documents. If not, I urge you to do so as soon as you can. And then in terms of the coursework, what you have before you are the certification requirements. Again, all of these have been shared with you ahead, were shared last Monday, and then shared via multiple channels. In case you missed them the first time, they came with your letter of acceptance. And then on Friday, we shared the final version of the slide deck. In the group work, so today and tomorrow, we'll be working on real-world challenges. You submitted challenges. We've shared them back with you in the slide deck, and that's what we'll be focusing on. So the challenges that you bring to the table, together with the best available, newest guidance from the World Health Organization, that is what will be making this course, the substance, the heart and soul of this course will be that conjunction of the best available guidance with the real world challenges that you face. The individual work, we've shared what's called the rubric as well as a template document with you. Your challenge is to very quickly develop an action plan. Think of it as the kind of assignment you get when it is not in your work plan, you did not expect this at all, and your boss asks you to, within the next 3 days, to do something that is actually quite stressful and intensive, but he or she has asked you to do it, and you need to deliver the result. So you have 3 days to develop an action plan where, in an ideal world, you would probably want at least a week, preferably 2 or 3 or 4 weeks to balance out with the rest of your workload. But just like in the real world, sometimes requests will come on an emergency basis, and that time pressure is a key part of the learning process. You will find that what learners report is that having that time pressure for those who are able to face up to it actually significantly accelerates the learning. And people tell us, I saved so much time because I did in 3 days what I thought would take me weeks to do, and I turned out to be able to do more than I thought was possible.